Ngan Nguyen is a PhD student at the University of Strathclyde. She will be presenting her research about hybrid system simulation models for transmission of healthcare-associated infections. So I'll pass it on to you, Len.
Thanks, Diego. Hello, everybody, and welcome to System Dynamic Conference. My name is Nguyen. I'm a second-year PhD student from the Department of Management Science, University of Strathclyde. Today, I'm going to discuss about how simulation modeling have been used to study healthcare-associated infection and how the method have been combined in this field. The application of 3 types of simulation model, including system dynamic, discrete event simulation, and agent-based modeling to investigate healthcare-associated infections, has greatly changed over time. System dynamic has long been used to analyze healthcare-associated infection dissemination in hospital and infection control policies. It is suitable for investigating the long-term behavior of the system containing large patient populations, which are considered to be homogeneous and therefore can be aggregated into compartments. It is useful for macro-level modeling to reflect long-term consequences and discover long-term solutions that may provide effective solution in policy decision-making at a high level. Agent-based modeling has been increasingly used to model healthcare-associated infection in recent years. It is easier and preferable for modeling the heterogeneity of small population, like an intensive care unit, rather than a large population setting. This method can also help understand the influence of different patient referring and transferring patterns among healthcare facilities within a network due to variation in their geographical location, policies, services provided, and variation in individuals' decision. Similar to agent-based modeling, discrete event simulation allows incorporation of detailed patient attributes and is well suited for modeling the procedure of activities that patients need to progress through. However, unlike agent-based modeling, discrete event simulation does not consider social context and interaction among individuals, and therefore transmission of infection needs to be simulated indirectly in a discrete event simulation model. It is therefore less satisfactory for simulating transmission of pathogens, possibly accounting for the less frequent application of this method in healthcare-associated infection in comparison with the use of system dynamic and agent-based modeling.
Hi, I was just going to tell you that there was no change in the slides. Okay, perfect, continue.
Yeah, so now I'm going to walk you through different design for combining different simulation modeling methods that we have observed in literature in this field. So the first one is parallel design. So we have the study of Dagata and his college in 2007. They use they use system dynamic and agent-based modeling to represent the same system. So they model the transmission dynamic of antibiotic-resistant bacteria in a hospital setting from different levels of details. So an agent-based model was used to model heterogeneous patient and healthcare worker behavior within a typical hospital setting and simulate infection spread. A corresponding system dynamic model represented the system at an aggregate level that provided the interpretation for the behaviors of the agent-based model over a large number of simulations. Sorry, got the wrong slide. So the next design is sequential design. In the study of Van Doing in 2008, they used a sequential design in which system dynamic and discrete event simulation was combined to capture different parts of the same system. In their study, a system dynamic model was first built to simulate an influenza pandemic in the community. Discrete event simulation was then adopted to simulate the transmission dynamics of influenza in a long-term care facility. As the prevalence of influenza virus in the community influences the rate at which patients, healthcare workers, and visitors introduce the virus when they enter the long-term care facility, the prevalence and the incidence of infection generated by the SD model were passed to the DES model. This hybridization includes understanding of transmission dynamic of nosocomial influenza in the long-term care facility by taking into consideration the impact of infection prevalence in the community on that long-term care facility. The next design is the interaction design. The study from Kadasloma in 2013 used agent-based model to simulate the spread of MRSA among patient and healthcare workers in an intensive care unit. This model was coupled with a system dynamic model, which simulated the transmission of MRSA in the community through hospital admissions and discharges. The hybrid model captured the interactive influences between hospital setting and community setting, while the transmission within each setting were grounded in each method. So the agent-based model and the system dynamic model adopted could operate independently, or they could work together to enhance the understanding of the impact of overall reduction in antibiotic use upon MRSA selection in both settings. Moving on.
Sorry, just to interrupt you. You have 2 minutes to wrap up.
Yeah. So the last two design are enrichment design and integration design, which you can see that you can use the reference list to look into more detail into these two designs. So basically, for the integration design, the agent-based modeling and the system dynamic component hybrid model were take on equal footing and inseparable. So the adoption of hybrid simulation model has become increasingly common as healthcare systems are highly complex, dynamic, and interconnected. Infection and other problems in the context of healthcare gained from different simulation modeling methods may benefit from the complementary view gained from using multiple simulation modeling methods together. Thank you for your attention and listening.
Thank you, Lei. I don't know if anyone has any questions that wants to pose to Lei. You can raise your hand or just post them. We have one question from Rachel Freeman. I'm gonna unmute you, Rachel. You're unmuted.
Hi. Yeah, I'm just wondering, I'm not quite sure I understand the difference between enrichment and integration in terms of what kind of questions would you be looking to answer by these two different approaches?
By the enrichment design and integration design?
Yeah, I mean, would they be used to answer different types of questions or to look at systems that have different structure or dynamics?
It depends on the question you try to answer and depend on the purpose of the study, but there are only slightly different between enrichment design and integration design. That in the enrichment design, one method is predominant, while the other method or just one aspect of the other method was incorporated, while in the integration design, all the methods the modeler use are treated on equal footing, and it's impossible to separate them from the hybrid model. So it's just the difference lie on the interaction between different components of the hybrid model, but which design a modeler should choose to use depend on the purpose of the study and the question you try to answer.
Okay,
Thank
there's
you.
another question. Thank you, Rachel. There's another question actually from Professor John Moorcroft. I don't know if you want to say it yourself, Professor.
Yeah, I guess.
Yeah, we can.
You can hear me? Okay, yeah. It was a very simple question. Which design approach do you think shows most promise in work?
I would say that integration design would show a promise in work. The reason for it is it seems like all other data using different simulation method quite independently, and there's some interaction between model, while the integration design allow you to model a problem more naturally. It's just at the moment we lack of tool to be able to do it. So apart from any logics, which allow you to combine two different simulation methods seamlessly, I don't think there's any other tool that assist the modeler in doing so. And also, apart from the technical issue, it's just we haven't got a thorough framework to instruct the modeler how to combine the three simulation methods together.
Okay, thank you. That's interesting. And the idea that you might be looking for a framework too sounds good to me. Okay, thank you.
Thanks for your question.
Thank you. We have time for maybe one or two more questions if anyone wants to post them or raise their hands. Okay, Rachel, again, yeah, I think you can unmute yourself, Rachel.
Oh yeah, so just a follow-up question. Are these models always what you might call multi-layered? I mean, so you've got an aggregated level and then you've got a level where you've got actors interacting. So presumably there's some kind of interactions between the two layers. I just wondered if you could give an example of where there's this sort of multi-layered model.
So because there are a limited number of hybrid simulation models, like studying healthcare-associated infection, we actually found only 9 samples together. But more of them, if you look at the last one, which is integration design, so the SD model is used to simulate the inter-host dynamic of antibiotic-resistant organism inside each patient. So the interaction between patient and healthcare worker were represented, and it was agent-based modeling, and they have an SD model embedded into each agent to represent the dynamic within a patient. And the system dynamic, which has a stock called bacterial population load. So the level of this stock will affect the transmission between when the two agents interact with one another, and it also define how a patient will respond to an antibiotic treatment that they receive.
Okay, great. Thank you, Lei, and